Does Accutane always work? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice specializing only in the treatment of acne, so that's all we do. And we like to share our insights and our experiences and our observations with acne sufferers who are navigating the path toward clear skin. So we hope you find this useful, but remember, this is not medical advice. This is only for educational value. So does Accutane always work? So this is an important question because I'm going to give you some insight into what we see in our practice. So the good news is that most of the time Accutane works great and patients are exceedingly happy. And it really does a good job. It takes away all of the acne breakouts and clear skin is the result and everybody's happy. And that's the usual result. However, aside from the fact that there are potential side effects, that's not the point of this video. But I'm going to focus on another aspect. And that is, how about those times when Accutane doesn't work? So there are those times. Now, thankfully, those are not very common. And as I said, most of our patients, they do great and it's a miracle medicine. But for a small group of patients, it becomes a challenge because some patients just don't respond well. So just to give you some insight, we'll have patients sometimes, we start out with our treatment and right off the bat, they start having a flare-up. So that's something that a lot of people call the purge, but that's not a very technical term, but it means that they're getting worse. So they're having an exacerbation of their acne breakouts. We don't know why that happens, but we do know it happens in 20 to 30% of patients, typically in our experience. Most of the time when that happens, it's usually very minor breakouts, maybe a few extra pimples, and it usually goes away after the first month or so. But sometimes it's more than that. Sometimes it's more pronounced. You have more breakouts, bigger pimples, and sometimes it can be severe with big cystic breakouts and really a severe exacerbation of acne. So you have to be careful. So that's one type of scenario where patients may not do great in the beginning. But the good news is that even if that happens, a lot of those patients, most of those patients eventually calm down with their breakouts and they start to improve and then they have a great treatment after all of that. But there is still a smaller group of patients that no matter what we do, they keep getting worse. So no matter if we lower the dose or if we take a break and let everything calm down and then slowly start back, no matter if we add additional medicines to try to prevent or lessen the flare of acne, nothing we do works in that small group of patients. And it can be a very challenging process. So for those patients, sometimes after we go through all of the different changes and modifications and manipulations trying to get them to respond in a favorable way without having a flare-up, there is that small group of patients that no matter what we do, they continue to flare and have more breakouts. Now, that's not what we want. We want patients to have a good result. We don't want more breakouts. So we're very careful about patients when they're continuing to break out. And eventually, if they just don't respond favorably, sometimes we just can't use Accutane for them. And we have to pursue an alternate treatment option. So the good news again is that that's a very small percentage of patients in our experience. The not so good news is that it's a very challenging experience to go through for both patient and doctor. The patients are frustrated because they're not getting better. The doctor's frustrated because anything that is done just doesn't really turn things around. And so it can be a very challenging time. But once again, it doesn't take away from the ability of Accutane for the vast majority of patients who take it to really work exceptionally well and clear up acne completely and give people a chance for clear skin. And it's really a life-changing medication for the vast majority of patients. And we just have to do our best with those who have more of a challenging response, and most of the time we can work through that. So thankfully, it's a very uncommon circumstance when we have a patient who just can't tolerate the medicine.